As pelvic health practitioners, we can positively impact birth and postpartum outcomes, but we need OBGYNs to know what is possible and why it is necessary. So, in today's episode, I share with you what I wish every OBGYN would know to ensure that we are doing our best together in providing care for our pregnant and postpartum clients.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode of the Birth Healing Summit podcast. I'm so grateful that you're here. And today, I would like to share with you what I would hope OBGYNs would know more about the body in pregnancy and in postpartum. And this is from a pelvic health physical therapy perspective. And for those of you listening in that are also in the pelvic health birth space, I feel it is our responsibility to try to do our best in sharing what we know works well with the body with other practitioners. And so this is my attempt of letting OBGYNs know of what I would love for them to know more about from a PT, a pelvic health PT perspective. And so I'm going to talk about both the pregnancy aspect of things and then also postpartum as well. And so back pain. I'm sure that as an OBGYN, you hear it a lot, and your clients complain of this a lot. But I would also really would love for you to know just some simple little things to determine whether the pain is, is it just a postural thing, or is it something that they're doing that we could easily instruct them to do it differently? And I know, please believe me, I know OBGYNs don't have a lot of time with their clients, but please refer them out, get them some pelvic health PT, and let's not just dismiss it as a part of being pregnant, because there's so much that we as pelvic health providers can support our pregnant clients in being more comfortable throughout their pregnancy. And then I would love for OBs to have a greater understanding of baby's position in the body and not just be concerned about the head being down towards the pelvis, but understanding the nuances of an offset head, of a head heading into a hip, and understanding the impact of how that can prolong a labor because the uterus now has to work to get the baby's head into the midline, and we can really make effective change and get baby nice in the inlet prior to the start of labor so that the uterus doesn't have as much work to do. And so we had the coolest, so I'm going to go off tangent here a little bit because I wanted to share just the coolest experience in a course in Salt Lake City, my pregnancy course. And we brought in live pregnant models, and one of the models was having some symphysis pubis pain, and she had such a hard sacrum, and baby's head was very easy to palpate because it was sitting more anterior. Actually, we didn't catch it at the beginning, but we think that the baby's head was actually compressing onto the pubic bone. And that was because her sacrum was rotated, and it was heavier on the right. So it was rotating to the right and jamming up on the left, kind of pushing baby over to the right-hand side a little bit. And when we made more room for the sacrum, got the sacrum happier and got it in moving better, the baby's head dropped. So it was a little bit harder for us to find it afterwards when we had adjusted things and created more room for that baby. So I would love OBGYNs to be able to see the changes that we can make in our pregnant clients with baby's positioning and how that can impact birth and get them to look at things beyond just, oh, the baby's head is down, but where is that baby's head when it is down? So if you ever get a chance to talk to some OBGYNs, when you understand this, please share that with them that there's so much we can do, especially with the round ligament pain. And I would love all OBs to know that, yes, round ligament pain can kind of go on one side, then the other side. But if it's constantly on one side, if a person has pain on one side that all the time, that is a dysfunction in that ligament, and that tightness and restriction in the round ligament can impact baby's position in the belly. And so I just would love more OBGYNs to understand how the uterine ligaments impact baby's position in the belly and how that can then impact the birth. And so, yeah, that's what I would love them to know. And then another big piece is during the labor itself, if if every single OBGYN understood how if when they come into the room, their presence in that room, how it can affect the birth space and mom. And if they could just connect in with mom and let them know that you care, that is the biggest piece to the puzzle to prevent trauma. So I really would love every single OBGYN to understand that and then to just allow the birth process to unfold without intervening. And yeah, so and then also how much your words matter in that birth space. And it matters for us too, for everybody in the birth field. We need to be careful of what we're saying to our moms and not create fear, not create the um, to not create the doubt in a person's ability to birth a baby. So I think that's something that we all as practitioners need to understand when we're working with pregnant clients. And then in the postpartum period, and I'm sure there's more that I could go into in the pregnant part, but I don't want to keep this to be an hour. I want to keep it shorter. So these are just the top things that I have thought about. And in the postpartum period, I would love for, well, really, for any situation, I would love for the OBGYNs to throw away the speculums after they've done what they need to do with them. And for them to be able to understand how to palpate the tissues and understand the importance of the tissue's mobility to the overall function and health of this pelvic space. I just think that you're, as OBGYNs, they're looking at the health of the tissues, and yeah, things look healed, but when we have scar tissue in that area, yes, scar tissue can look well healed, but what's the mobility of that scar tissue? We know that scar tissue cannot move as well as normal tissue. So just because it looks healed doesn't mean that it can function well. And scar tissue at the introitus is a big issue for insertional pain with intercourse, which we know. But lately, I've had a couple of clients that have had hysterectomies. And I had one that had some really unique tissue at the surgical site intravaginally. And it was like the sutures never dissolved. And I was asking the client if, did they use dissolvable stitches? And she's like, I would think so. I don't know. And because I could feel the really straight up and down lines of suturing in there. And then there was also a pocket, it felt like, and I felt this pocket in a couple of clients that are complaining of discharge that they didn't have prior. And so, getting in there as an OBGYN to put your finger in and feel what the tissue's mobility is like when we have scar tissue could be huge for your greater understanding of what your clients are complaining about and knowing that we can manipulate that scar tissue to get rid of that pain. So please use your speculums and then take them out and touch the tissues. That's what I wish every OBGYN would know. And I would love to educate any OBGYN that is interested in learning and learning how to more effectively understand the complex relationship between the vaginal tissues, the muscles, the organs, and how it all relates. I think that as pelvic health physical therapists, occupational therapists, we that's our specialty. And I would love to share that information with some OBGYNs. Um, and that's the other thing is, OBGYNs, I wish you could understand more how to assess for pelvic floor muscle function because you can't do that with a speculum in. And so learning how to palpate for the function of the pelvic floor muscles should be huge and what could be huge. And I also would love every single person, even all women who have cervixes remaining in their bodies, to understand that the cervix must move. So the cervix needs to be able to move freely up and down and all around. So my goal when I'm working with my clients is to make sure that the cervix is like a piñata in there. And that's the best analogy I can think of because it needs to circle all around. It needs to be able to move up and down. It needs to move to the left, to the right, because it needs to get out of the way of the penis for intercourse. So any deep thrusting pain during intercourse could be a restriction to the cervical mobility. And if we can help increase that, that goes away. And I just had the cutest call from one of the hysterectomy patients that had had a hysterectomy. It was a good friend of mine, and I know her husband. And she was having deep thrusting pain with intercourse, and I got the cutest call from him saying, "Thank you so much, Lynn, because that was really fun." They were able to have intercourse without any pain, and so I just think that that is so amazing, the work that we can do to help change that. And it all comes down to now, obviously, this person didn't have a cervix in there, but it was the scar tissue from the hysterectomy that was inhibiting the tissue's ability to move. So I just helped encourage that a little more, and then everything was able to move more. So yay! This is, I would love some OBGYNs to understand how effective we can be in getting the tissues to shift and change in there, especially after birth, after hysterectomies, anything that goes on. And I would also love them to understand that the pelvic bones need to move. And I would love them to understand the mechanics of the pelvic bones and how the sacrum needs to lift backwards, and that maybe we would get women off of their backs more and or put towel rolls underneath their ilium so that their sacrum has a little bit more mobility if they are in a lithotomy position, and just help them to understand the mechanics of what needs to happen during birth, and then help them to understand that sometimes those bones don't go back to their original position afterwards. So, and we have the capacity to help mobilize them and help support moms in bringing them back together. So those moms that are in pain, that are having back pain, and know that the referral to PT to us would be so amazing. So, um, the pelvic bones, the cervix, the tissue, scar tissue, everything has to move in there. And then for those clients those patients that they're addressing that are complaining of prolapse-like symptoms, I would love for OBGYNs to know how to assess in a standing position to get a better picture of what is truly happening there with gravity. Because there's so many times where that bladder looks and feels normal in there. And when you get them standing up, it's boom right there at the opening, and it's prolapsing. So um, I and if all you have in your offices are ring pessaries, please refer out to a PT who can fit for pessaries, because we have more time to spend with clients to fit for them. And I would really encourage all pelvic health providers to become more aware of fitting for pessaries. We need more providers doing so and understanding how to do it correctly. And that would be just incredible to be able to share what we know works so well for our clients. And I would love to educate OBGYNs more about this, because I think there's some simple little things that they can do to make some quick changes in there that doesn't need to take a lot of time, that could really be impactful for their clients. And, not everybody can afford pelvic floor PT. I get that. Pelvic occupational therapy, going to a body worker. So if midwives and OBs knew how to manipulate these tissues intravaginally, and learn it in a respectful way, they could really make some beautiful changes to the function of the vaginal space with knowing just a few little tips. So if you guys know of any OBGYNs that are interested in being educated, please have them reach out to me. I'd be happy to come and set up a personal one-on-one training with them to help them learn this stuff, because it is so important. So thank you, everybody, for listening in. Please share this podcast episode with any OBGYNs that you know, and midwives as well. And just let's help spread this word so that we can support moms better. So thank you so much for listening into this episode, and we will see you all in the next one. Please share this episode with any providers that you know might benefit from hearing this. And let's get the word out there so we can better support moms. Here's to smoother birth and faster recoveries. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.